Hello and welcome back to my channel. Hopefully today I'll clearly answer the question, what's the difference between a dental assistant and a dental hygienist? So my joke, should I tell my joke? My joke when someone asks me, I just quickly say, well, the difference actually, if you want to know the hierarchy of a dental office, it seems as if the dentist is the queen or the king of the office. We have the hygienists who are princesses and princes, and then there's the assistant who's the servant. I only joke like this because I was an assistant for 2 years before I became a hygienist, and they work their butts off more than anyone else in the office, and they usually get paid the least, and it's just a bummer. That's just what I always used to say, obviously. It's just my poke at comedy. I think the most important thing is to not call it a hierarchy. That's just my funny joke. I think everyone's equal in the dental practice. We all have our own different jobs. So everyone's important. Basically, the dental hygienist cleans your teeth and the dental assistant assists the doctor during fillings and other dental procedures. There's a whole list of duties for each, and there's a lot that actually they both do, such as they both take x-rays, they both can prepare and sterilize instruments and equipment, and they both can take impressions of patients' teeth and make models and things like that. But there are some duties that do not overlap, such as a dental assistant will not clean anyone's teeth, and a dental hygienist generally will not be in there during your filling or crown. There's like an assistant who is with the dentist all the time, working one-on-one with the doctor, packing cord and helping, serious. And then there's the assistants who are on sterilization, who are cleaning the instruments, maintaining and performing office management, which is super critical and important too, and it's really helpful because not all offices have an assistant like that. Sometimes the one who's right in it, doing everything, has to do both. Went to school in Chicago. You don't need anything. It is not required to have a degree, actually. However, many assistants do get their certificate in dental assisting, giving them the degree CDA, Certified Dental Assistant. Many of the dental assisting programs are less than a year. There are options to get extra certificates, such as in sealants or polishing, but they're not required. Every office is different. Some states do require a special certificate in radiology, however, but not Illinois right now. To become a dental hygienist, you should watch my video because I tell you all about all the ways you can become a dental hygienist, and it's really exciting, and there's a lot of different routes and options to get there. But quickly, in summary, you need to attend dental hygiene school, which can be anywhere between probably minimum 3, but at most 6 years. I would say average 4 years to become a dental hygienist. You need to get licensed in the state you're working and nationally. At least this is for America. Your title will be RDH. Registered Dental Hygienist. But really quickly, I'll just tell you a list of things that each do just to answer the questions for this video, and then I'll leave. So you can turn it off now if you're bored. The duties of a dental hygienist. Not limited to: works one-on-one with the patient, cleans teeth, which is removing calculus, stain, and plaque, hard and soft deposits from all surfaces of the teeth, and includes charting patients' dental conditions for the doctor and perio charting, taking probing measurements. Also includes fluoride and decay preventatives, as well as teaching patients appropriate oral hygiene strategies, collecting information about the patient's oral and medical history, and of course administering local anesthetic if the patient needs a deep cleaning or an SRP. The duties of a dental assistant, not limited to: supervise jobs on patients' teeth such as packing the cord, provides direct aid to dentists such as passing instruments and taking impressions and making molds of patients' teeth. They do that a lot more than most hygienists. Of course it depends on the office. And sending out and organizing materials that need to be sent out to the dental labs. Be nice to everyone. Nobody's less important than somebody else. Everyone's equally important. Love, peace, and teeth.